My name is Ajay Kumar, Chief Clinical Officer for Hartford Healthcare. We're going to get started with our daily briefing, and I'll start with the total number of patients we're managing across the Hartford Healthcare. We have 62 active cases across the Hartford Healthcare acute facility today. 3 patients in Bacchus Hospital, 1 in Charlotte Hungerford. Hartford Hospital has 28 patients. Midstate Medical Center has 6 patients. St. Vincent Medical Center has 12, and Hospital Center Connecticut has 10 patients, and Wyndham Hospital has 2 patients. Behavioral Health Network has no patients today, and 104 patients in Community Network. That's a total 62 patients in acute setting at this time. These are certainly much better number than we've had before, and we continue to see the decline at this time. A number of patients who are on ventilator is about 12 across the system. So we're doing very well with that as well. We've talked about the visitor policy last week. Yesterday I talked a little bit about that. We're really happy to see how the community is reacting to relaxing our visitor policy, especially in the acute setting. As we go over the next several days, by Monday, our emergency rooms also will have a relaxed visitor policy where the loved ones can come along with the patients and be in the room as well as time needed. We are obviously doing it a very thoughtful and a thoughtful approach at this time. Want to make sure that the visitors and patients and our colleagues are all safe while we relax this visitor policy. Everybody gets a mask, everybody gets screened. So this is a wonderful way of making sure that we are keeping the safety as a top priority as we relax visitor policy. We're also very happy to report that folks actually who have been delaying some of the surgical procedures and things like that, especially the sensory surgeries, they're coming back, and they're coming back to the hospital seeking care. And last week we had increase in number of patients seeking the care, and we've had a nothing but safe approach. Individuals are getting informed, being informed by the COVID and the safety precautions we're taking, and we're finding generally a good response, and it's a good place to be. It's a good sign of recovery, at least for Hartford Healthcare at this time. We talked about the hospital safety protocol while we try to come back to the normal or the new normal as we define in Hartford Healthcare. Our safety becomes the highest priority right now as we are making sure that every individual is screened, all the masks and PPE is in supply in appropriate places. Individuals, if they do have any signs or symptoms, they get the appropriate and swift care. We're reaching out to the community to make sure that the education is still robust. Our call center remains active. Our colleague support center or community support center, especially about the mental health and other things, we continue to provide support to the community and our Hartford Healthcare colleagues. Testing is going very strong. As you know, we continue to partner with state in providing the testing in the places where the access can be difficult. We continue to expand on that. We do have a good capacity to continue to test. The turnaround time still varies anywhere from 24 to 72 hours, but this is definitely a lot of improvement since March and April at this time. I think this question keeps coming back regarding a variety of different metrics as we're looking into the state and how the latest demonstration, the protest might affect, and what are we seeing. Look, this week we're going to be very cautious. We're going to be watching very carefully the effect of the demonstrations. It's almost about 10 to 12 days out from the time this protest started, the impact on that. I still believe that residents are generally wearing a mask, and they're taking all the possible precautions they can take. I understand in demonstrations such as like that, keeping a physical distancing could be a challenge. So we're going to keep a close eye on that. As I had indicated earlier on, and sometime in April, we all have exceeded more than 5,000 fatalities or death in Connecticut at this time, with more than 40,000 cases. We'll continue to see some lingering cases in the hospitals for some time. Throughout the summer, we will continue to see somewhat of a plateauing and then decline in our mortality rate as we go forward. We still have a fair amount of patients who've been in the hospital for long term on ventilators, and they've been spending 20, 30 days in the ICU. and these are the high-risk individuals. The rate in the nursing homes and the vulnerable population still remains a concern, although a lot less than what we had at least in April. So going forward, I think we need to continue to keep the safety as a paramount focus across any healthcare or any other setting at this time. We still need to be careful about this virus. It has the same concerns that we had in March or April at this time. And we're going to have to continue to keep an eye on that. The physical distancing would be important. Wearing a mask all the time would be important. Hand hygiene, not touching the face and other things needs to be reminded on. But at the same time, a recovery to some sort of a normal sense of us enjoying the summer and the time is also important. The balance as we go forward would be critical as we go forward. We are doing a lot of testing, as you know, in the state of Connecticut, and we do more testing, the positivity rate goes down, and this conversation has been happening. What does it mean by that? It's always it's a denominator and numerator kind of a mathematical model. When we do a lot more testing, our number of patients who are coming positive is percentage-wise is lower. As long as we have a low amount of positivity rate and high amount of testing, it actually gives a confidence to the state that we have abundant ways to manage whatever the new crisis might come along. It allows us to see any uptake might happen over the time. So the measures we're taking by increased testing, all the things we talked about, the physical distancing and all those things, positions Connecticut in a different place at this time to be able to reopen safely. And that's a good place to be. The low positivity rate should not confuse folks. It doesn't mean because of the low positive rate that we are safer. The virus is taken kindly on Connecticut. That is not the case. It is just we're testing a lot of people, and that's why our denominator is high. These are the few questions that come my way since yesterday. I thought I'll address that, and now I will introduce one of my colleagues, Mr. Ariel Pino. Ariel Pino is a manager for the guest services at the Hartford Hospital, and he'll be talking about some really neat innovation he's been working on. Thank you. Ariel.
Thank you very much, Dr. Kumar. Good morning, everyone.
Good morning.
My name is Ariel Pino, and I'm the guest services manager at Hartford Hospital. And I would like to share with you this morning a new product called the Clear Mask, which is what I'm wearing right now, as you can see. And we're utilizing this mask throughout Hartford Healthcare. Hartford Healthcare saw a need to improve our communication with our patients, families, and community, and we are now using this fully transparent face mask called the Clear Mask. This mask will help our healthcare professionals improve their communication with our patients. Unlike the mask, this Clear Mask helps us see each other's entire face and facial expressions, making communication more natural and accessible. Unlike other masks, this mask will continue to allow you to see the entire face, as you can see here that I'm demonstrating, and it helps with the communication, in particular with our deaf and hard of hearing population who prefer to lip read will truly benefit from this Clear Mask. So this Clear Mask is very easy to put on. It has an adjustable easy strap on the back that allows you to adjust it to ensure its comfort. It is also fluid resistant and latex free. The ability to see facial expressions and emotions ensures clear communication and can help improve the patient-provider relationship, quality of care, and patient experience. Thank you very much.
Thank you, Ariel. That was wonderful. A few other, just the numbers I thought I'll share with you. Hartford Healthcare has done 58,000 tests so far, and that's a significant number. And we continue to have, increase our testing capability across the system, across the state as well. So anyway, at this time, I'll open for any questions or comments.
Dr. Kumar, this is Pat Eaton-Robb with the Associated Press,
Hi.
and maybe the head of guest services can answer this as well. Can you talk about any changes Hartford Healthcare has made with regards to visitation for people with disabilities, especially cognitive disabilities, who require someone to be with them at the hospital? I understand the state has entered into an agreement to change some of those policies. Are those in place already at Hartford Healthcare? I understand you're changing the visitation policy for everybody, but are you doing anything special for these people?
Yeah, I think I'm happy to answer that actually, and I've been leading the effort across the system on that part here. So we've been very careful, especially the individuals who require extra assistance, to accommodate even during the COVID times as well. And we made exceptions on those case-by-case basis. Generally, the way the process works, if anybody requires any help, they should reach out to the nursing director or a VP of the nursing, and they are making sure that adjustments and accommodation is made. What we have advised, we've been advising an individual, and this is very case-by-case basis, quite frankly, is that we want to make sure that we limit the exposure for the individual who is supporting those patients who requires extra assistance. In the sense that they're given masks, we prefer only one person if they can be with the patients. So obviously, sometimes require more than one person. They're advised to be follow the right precautions such as hand hygiene and things like that. And so we take this very seriously, especially the individuals who require extra care, and we've been doing it all along during the COVID crisis as well.
Thank you.
Dr. Kumar?
Yep.
This is Tracy O'Shaughnessy with the Republican American. I missed you yesterday, sir.
Hi, Tracy.
We've seen decreasing numbers of new cases at many of the state's hospitals, including your system.
Yep.
How do we know whether we've also seen a decline in the positivity rate or the infection rate? Does this mean, can we conclude that most of the people in Connecticut who are going to be exposed to COVID-19 have already been exposed, which leads to the obvious question, is the disease starting to peter out?
Yeah. So two parts answer to this question. One, maybe there's a three-part to that. So you're right that the hospitalization rate has gone down, and the positivity rate, which is a ratio of number of individuals who are positive and denominated by the number of testing we are doing, is declining at the moment. The decline in positive rate talks about our widespread testing more than the number of individuals who may be positive. I think the reason the decline in positivity rate indicates our strength of our system or our Connecticut to be able to do more testing. It's a large amount of denominator we have right now. We're testing more. If we test more people and a small number comes back positive, it appears that the positivity rate is declining, but it doesn't mean the virus is behaving any differently at this time. We're just able to offer more testing. So with that said, to make a second conclusion out of that, anybody who's supposed to get infected is already infected. That is not true as well, because what we've been doing is that we've been restricting some visitations and physical distancing and all that. So we have limited the exposure to the vulnerable population quite a bit. And I think that's a really important tactic, and we talked about early in the March, is to be able to contain the spread, able to create a significant challenge for the healthcare system to manage the demand. When we talk about flattening the curve, it is a slow spread rather than an exponential spread. So the measures we took place back in March and April of limiting the physical distancing, limiting the visitations, limiting all sorts of measures we took to reduce the exposure to each other allowed us to have a slow level of spread. That means less amount of community got exposed, and that's why we're seeing a positive rate to be lower. But there's still plenty of individuals who are very vulnerable. There are a lot of people actually who have not been infected, thank God, because they were actually somehow protected because of physical distancing. But if they get infected, you will see a spike. That's why we talk about the congregation of the large groups, large events, visiting your old grandma or things like that. You could expose those individuals who are vulnerable. So the numbers, the increased testing, the positivity rate, these are important metrics. They allow us to study over the time if there's a blip in the data. If we see a positivity rate going up at any given time, then it tells us two things. The virus is resurging, it's coming back, and we can isolate a pocket in the area and the geography and work towards containing that. So these data it means a lot, but it does not mean that the virus is less contagious than before. The second part of the question is the worst is over yet. Well, I think let's define that. If your definition is that the worst for our healthcare system to be able to manage the community need is over? Yes, it is. I think we've done a good job in managing that part here. We as a society has done a good job in managing that part here because we were able to contain the rate. Our hospitals did not get overwhelmed. We were able to manage with the right amount of care process. The second thinking we've had all along in the pandemic is that the more we delay of large number of exposure, the better therapies will be there. So if you go back in Feb, seems like ages ago now, we didn't have convalescent plasma, we didn't have remdesivir, we didn't have many therapies at the time. Now, individuals who are getting sicker now compared to those who got sicker at least have those therapies with some proven benefit. Down the fall, we would actually have a much better therapies over the time. So delaying the exposure is really helpful for our society. The goal for our society should be to reduce the suffering, the mortality, the death, and things like that. And as long as we can continue to delay that and we have a better therapies available, we'll be in a much better place. I hope that kind of explains and give you an answer. So for now, for the hospitals, yes, the worst is over yet. Could it be worse in future? Yes, it could be. If a resurgence comes back, it could very well be. But for now, we are in a good place.
We saw a bunch of people congregating in peacefully or not in these last few days with protests. Do you expect a spike in cases because of that mass gathering?
Yeah, I do expect some spike actually. I hope it's not going to be that significant for Connecticut because I like to still believe the Connecticut, as much as I've been keeping an eye on that, and I must admit that I don't have all the knowledge of all the protests happening in Connecticut. But what I've seen and what I've noticed that personally is that generally they've been peaceful. Individuals are wearing masks. They are at least using some sort of a protection at the time here, which is a good place to be. Now there are some parts of the country where we've seen the photographs and pictures and videos and all that. It's a lot more concerning. I still believe the Connecticut would be fine despite the protests we have. We will have some. We may have some uptake on the numbers, but it would be manageable.
Thank you, sir.
Any further questions?
This is Tim Lammers.
Hi, Tim.
From 561. I have a question for Dr. Kumar. I was hoping you could tell me a little bit more about Connecticut's current case fatality rates, because I think we've all been under the impression for a long time that while the percentages are alarmingly high, once we were able to do more testing and to catch more mildly symptomatic or asymptomatic cases, that percentage would go down. But to date, it hasn't. It went over 9% back on May 14th and has not budged. So my question is, to what degree are you surprised about that, and what factors do you think are going into that or still need to go into that to lessen it?
So Tim, I want to make sure that I understand your question correctly. I think what you're indicating is that the case fatality rate, which is the number of individuals who are positive with coronavirus are dying, that rate is not going down. If I compare the numbers from about 2 weeks ago, I like to believe the numbers have declined, but I hope I have the right data as you're looking at it as well. These things can be confusing, especially I don't want to make a statement in front of the media on that part here. My understanding was the number of cases we are having, individuals who are dying in this last 2 weeks has been lower than the previous 2 weeks prior to that. So there is some improvement here. However, one of the things which is we all need to keep an eye on, and we've been talking about from the beginning, as we look into, there are a lot of different numbers we're looking at that. One is a cumulative number of individuals who have been infected. We've got 40,000 or something like that cumulative number. Since the time pandemic started in Connecticut, that's the number infected. The second data point we're looking into that, the hospitalization rate. We just talked about it, so I'm not going to rehash that. The number three thing we're looking into, the positivity rate. We just talked about the number of people who are positive based on the infection, the spread. The last data we're talking about is the number of people who are dying per million or total cumulative. If you extrapolate the number, the per million death in the Hartford, Connecticut, the numbers are declining. However, there is a trailing indicator here, because what happens when the curve goes like this, especially the case fatality rates, it goes up. By the time it comes down, there's a slow decline. It's not a rapid decline. It's always a slow decline. So there's a plateau piece, and then after the decline occurs. And that is because what happens is that there are some individuals in the community who are still staying in the hospital longer because they have still not improved completely, but still on the edge here. And then unfortunately, we continue to see some mortality happenings over the time. The second part of the mortality is the nursing homes and the assisted living, they caught on late in the sense, if you track back the history from the beginning, our fatality or the case rate was higher in the community that affected the hospitals. And then after that, the nursing homes, so there was a curve like this, and the nursing homes comes like that, and the assisted living. So that second wave, so as to say, in our community, which is hitting the post-acute air, the nursing home assisted living, we continue to see the mortality. And later on, we saw 52 to 54% mortality happening in that population. So we are at the kind of an overlap junction at this time. So over the next week or two, I think you will see a decline, significant decline actually in the mortality rate over the time. Hate to say those individuals who have been sicker, who were not going to make it or will not make it by then. And then our nursing homes and other areas which are taking a lot more precautions right now with a stricter visitor policy, increased testing of the employees through the government mandate is going to actually improve our performance, so as to say, in the mortality related area. I hope that answers your questions, but I do, I'm not entirely sure, Tim, that I have the same data as you have, is that numbers are not declining. I think the numbers are declining, definitely if you compare 2 weeks continuum, and that's how I look at the numbers.
Thank you.
Thank you.
If no one else is going to jump in, I'm going to ask another question.
Please.
This is Tracy O'Shaughnessy from the Republican, Dr. Kumar. One of the things that we are constantly looking back at is the flu epidemic of 1918. And when you look back at that epidemic and the terrific book that was done on that by James Barry, you note that in the spring of 1918, the health officials believed that they had really kind of got a hold of this strange new type of flu virus. But by the fall is when the virus really took a very dangerous and deadly toll on American soldiers and Americans basically everywhere worldwide. So we keep hearing about this resurgence in the fall. Is that a done deal? Do we know that that's for sure going to happen? And is there anything any kind of metric that we can look at to tell us that we are going in that direction?
Yeah, it's a great question, Tracy. So, so the times with early 19s and now are different. The hospitals are different. Our medical knowledge is different. Our society is different. The way we interact, the way we communicate is different. So a lot has changed since then. The protective equipments, the sanitizers, and many things are different here right now. So, I personally don't think that we would have the same resurgence of that level as we had at that time here. However, what we've been looking at the data with the MIT's analytical help, and we've been working in the collaboration with them. Our understanding is that we would have some uptick in the fall. It would not be as robust as we saw in 1912 at that time. It would not be a very pronounced peak, but there would be some resurgence. Difficult to define what that would be at this time. It depends on a lot of factors, such as social distancing, such as how we act quickly, what therapies will be available by then, and where are we going to be with our precautionary measures and travels and everything else we do at the time here. And that's yet to be seen over the next several weeks. So, but we would have some. The complicating factor which we're going to have at the time, which I'm somewhat concerned about, if anything, is that we would have the research into flu as well. A seasonal flu will come back as well.
Right.
So we would have two things, the seasonal flu
Right.
and the COVID-19. The symptoms, as you know, are very similar, and that becomes very difficult to differentiate and provide the care and all that. So as in Hartford Healthcare, as we began our preparation back in early January, mid-January for the COVID-19, in June, at this time, we're already preparing for the winter. We've already had started the discussion within our team. I'm leading the team of experts to make sure that we think about all those options, such as capacity planning, testing capabilities, our policies and procedures, especially protecting our colleagues and the community. How do we make sure we get ahead with the data and educate the individuals in the community to prepare for that? And I like to believe that most hospitals hopefully are thinking in the same way, and that would position us in a much better place in the fall. At this time, I'm actually concerned, but not terrified, not worried too much about the fall and winter. I think we're going to be okay. We're going to see some increase, but not to the level which is going to make it as restrictive as the last several weeks has been so far.
Can you sort of quantify what it means to be concerned but not worried? I'm thinking of the fall being a time when people, especially young people, will be congregating in close living quarters for schools and the like. Is that a kind of recipe for spread, or how will that be different than it was in March?
I think what's going to be different at that time is that individuals who even congregate will take extra precautions. They will be more aware of the people who are ill and how to distance yourself. Frequent hand washing and mask and other things will be helpful at the time. And we would have a rapid testing available, so individuals who become symptomatic, or who has concern about exposure would be tested early, isolated early. So our response would differ at the time quite a bit. And I think that is one change would happen since the March or February Feb time here. It's difficult to quantify really what that concern is. That when I say about concern, in the sense that I want to be cautious, I want to make sure that we all pay attention to that. We don't take our eyes off the ball. We don't let our guards down. This is going to be a challenging year for all of us, and it's going to be early. Winter is going to be somewhat challenging, but it is to pay attention to what's in front of us. We can get through this. We will get through this. We just had to be cautious. We had to practice the disciplined approach of our physical distancing, hand hygiene, other sanitary measures.
Thank you, sir.
Well, welcome. Tina, you have anything else?
We have a question for Ariel
Oh,
on Facebook.
Very good, Ariel. Please come in.
Thank you. What a great idea for a mask in the hospital setting. Can the general public, regular people, find this mask anywhere?
And yes, this mask is currently being available for healthcare institutions at this point. So right now, hospitals, healthcare systems, I'm going to just take this off so I can speak a little clearer, will have priority with ordering the clear mask. Any other questions?
I have a question for Mr. Pino too.
Yes.
How do you breathe through that if it's plastic instead of cloth?
It's very comfortable. I mean, it's latex free, it's fluid resistant, it's anti-fog. So it has these cushions, like foam cushions on the top and bottom, which makes it very comfortable to wear. So in general, it's very easy to breathe through the mask, in my experience.
Will they be used in the ICU, sir?
Absolutely. Yes.
It seems a particularly useful sort of human touch, if you will, in the sense that one of the things that we hear is that one of the most painful aspects of being in the ICU is the isolation, and people who come in to help you looking like, as I've been told, sort of like robots or astronauts. So this gives it a little bit of a human touch, right?
Absolutely. Compassionate service to our patients, in particular our deaf and hard of hearing patients who prefer lip reading. This will truly help with the patient experience.
Are we going to be able to get a picture of that to use for our publications?
Absolutely, yes.
Thank you, sir.
Any other questions? No? Okay, thank you very much.
Thank you, gentlemen.
Thank you. Thank you, Tracy, for your comments and question. I think this is definitely one way of making sure we connect with the patients in a more humanistic way. So,
You are the only participant in the
very good.
Okay, very good.
Thank you.
I think after Ariel.
Thank you very much. Bye.